The oral health screening guidelines for school nurses were developed by the Ohio Department of Health to provide practical guidance to school nurses who choose to conduct school-based oral screenings. School-based oral screening is optional in Ohio, and the decision to do screenings should be influenced by the availability of school and community dental resources for student referral. Conducting oral screening only has value if there is follow-up and resources are available in the community to refer families for needed care. An oral screening is not a diagnosis. Only a dentist can diagnose dental disease. Instead, an oral screening separates students screened into three groups: those with no apparent dental problems, those who need to see a dentist soon for diagnosis and any needed treatment, those who need to see a dentist immediately. If it is decided that school oral health screenings should be conducted, the school nurse, a community dentist, or a local dental hygienist can do them. In 2005, the Ohio State Dental Board approved schools, health departments, and Head Start programs as special needs programs. This means that registered dental hygienists can screen children in these programs without the dentist being present. Designation of specific school systems can be confirmed on the website of the Ohio State Dental Board. Although it may be ideal for oral health screening to be conducted annually over a student's entire K-12 career, each school should decide in which grades to conduct screenings. Make sure that your screening doesn't interfere with other oral health activities at school, such as sealant programs. You may be able to work together to get the screening done more efficiently so students are not out of class more than necessary. Review the school district policies and procedures regarding health screenings. Seek support from the district's administration. This is essential for the success of the screening program. Obtain parental permission in a manner consistent with school standards for other health screenings. Prepare appropriate forms needed for the screening: consent form, screening results summary form, and parent letter. Prepare the school faculty, staff, and students for the screening process. This is also a good opportunity to discuss oral health in the classroom with the students. Caution should be taken to prevent the transmission of microorganisms. Wash hands thoroughly at the beginning and end of each screening session. If there is no physical contact with the mouth, it is not necessary to change latex-free gloves between screening individuals. If, however, a gloved hand touches the mouth's mucous membranes, lips, or saliva, the gloves must be removed and hands must be washed or cleansed with disinfecting hand sanitizer before putting on a new pair of gloves and screening the next student. Disinfect table surfaces used for screening supplies before and after the screening session. If a toothbrush is used to clean a student's teeth, it may be repackaged and given to the student. Dispose of gloves, tongue depressors, paper towels, or gauze in the trash. If the plastic bag on the pen light or flashlight comes into contact with the student's mouth, dispose of the plastic bag and rebag the light. Waste from the screening should be disposed of properly and away from children. It is not considered hazardous material, so it can be thrown away in the school or facility dumpster. Your work table should be set up with the following supplies within easy access: paper towels, tongue depressors, toothpicks or toothbrushes, bagged flashlight or pen light, disposable latex-free gloves, hand disinfectant, gauze, a bagged ink pen, and forms for documentation. To conduct the oral screening, follow these simple steps. Place the student in a chair facing you so her mouth is as close to your eye level as possible. An alternative position for smaller children is to have them stand in front of you. Use a tongue depressor and bagged flashlight to check the student's teeth, gums, and soft tissues. You may need to use a toothpick or toothbrush to clean food from the chewing surfaces of back teeth. In order to be consistent in your screening, you should follow a systematic approach. The following is a suggested screening sequence. Look at the symmetry of the outside of the face. Look at the lips. Check for lesions or swelling. Ask the child to open his mouth and look at the inside of the cheeks. Tilt head to look at the roof of the mouth. Check the roof of the mouth, Check the throat and tonsillar area and surfaces of the tongue. Visually inspect the teeth following this sequence. As you inspect the teeth, also check the gums. Upper teeth. On student's right side, your left. Start in the back and move toward the front. Move from upper front teeth toward the back of the student's left side, your right. Lower teeth on student's left side, your right. Start in the back and move toward the lower front. Move from lower front teeth toward the back on the student's right side, your left. After looking at every tooth surface, throw the tongue depressor away. Record your observations. The results of the screenings should be kept confidential with no comments offered during the screening process. However, if the student requests results, let them know a letter with results will be sent home.